Assalamu alaikum. My name is Dr. Sayyida Amna Mahmood. So today I select the topic about the hemorrhagic cyst. As I discussed before, my lecture is in a simple cyst. Now I am going from discuss about the complications in the cyst, like a hemorrhagic cyst. So we have first the definition in the ultrasound. What is the ovarian cyst? And ovarian cyst is a sac that forms on the ovary with the soil up with the fluid, and sometimes the blood in the cyst is called as a hemorrhagic cyst. So this is maybe the thick wall, sometimes is a thin wall. So this is a simple cyst if it is a thin wall, but is a thick wall is a complicated cyst. Cyst is more than 3 centimeter, vary in shape, having some internal echoes and having sometime foldings. On the Doppler study, there is no flow around the cyst. This is very important part. So hemorrhagic cysts have no flow, because if there is a flow, so there is going to be a cancerous site. So you can see this picture, which is very famous in the ultrasound and everywhere. So we have a cyst which have the simple cyst, thin wall. Hemorrhagic cyst is little bit thick walled with the blood. Endometrioma have the some pedunculated masses like the projections, and the mature cyst teratoma have complex masses inside the cyst with the vascularity, and other type of malignant also have the vascularity within the cyst and around the cyst. So if the patient are come to you and having a cyst, you suspect the cyst she has, so what is the symptoms you are find? So first, there is a pelvic pain which is caused by the large ovarian cyst, because the small hemorrhagic cysts are silent, and just this is only the ultrasound finding. The patient feel the fullness, pressure, heaviness in the lower abdomen, and there is some bloating in the abdomen, sometimes vaginal discharge. If the cyst is ruptured, so maybe this is a very complicated part of the hemorrhagic cyst. If the patient is ruptured cyst, large cyst, which is going to in the shocked. Now we have to discuss about related to the non-ovarian, related to the complications of with the ovaries and with the ovaries complications. So first, the ovary have the follicular cyst, corpus luteum cyst, endometrioma, teratomas, tubular ovarian masses, cystoadenoma, cystoadenocarcinoma. What these conditions are related to non-ovarian lesions like lymphocyte, paraovarian cyst, hydrocephalus, endometrioma, extra ovarian lymphangiomas caused by the cyst by ectopic pregnancy, and less common is a peritoneal cancers, malignant mesothelioma, appendix like the mesoceles in appendix, duplicated cysts, entire duplicated cysts, leiomyoma, cystic degenerations in it, peritoneal inclusion cyst, retrorectal developed cyst, lymph node cystic degenerations. So these cysts are related to less common with the ovarian cyst. Mimic to the cystic lesions are, which is look like maybe the patient have the cyst, but this is also the related sub to excluded the differential diagnosis like ascites, bowel infections, pelvic infections, abscess, diverticulitis, hematomas. This is you can be excluded. So, and the renal problems and the PIDs. So the cyst is also causes the bloating, discharge, maybe cause a shock and some hormonal disbalance. What is the sonographic finding of the hemorrhagic cyst? You can first focus on this image. So what you can see, you see the internal echoes, hypoechoic fluid, some like thin or thick wall, irregular or some regular shape, some septa without internal vascularity, and there is a normal vascularity of the ovaries. So now, definition. The appearance of the hemorrhagic ovarian cyst depend upon the stage of formation. Duration of the cyst formation. It can take an of the following appearance. The appearance of the reticular appearance. This reticular appearance is a fence net waves form or fine reticular appearance, which is like a net. The commonest presentation of the cyst is multiple fine strands of the fibrin giving in the net-like appearance. This is called as a reticular appearance. The septation in the cyst are typical, non-vascular on the Doppler, and there is a thin wall. So the second stage, what is the second stage of this one? The second stage is retracting cloth appearance. The process of the cloth formation. The subsequent retractions within the hemorrhagic cyst result is triangle, and sometimes is a hemorrhagic clot in the part of the cyst, like a serous formation in the cyst. Like this is a net like appearance, which is called as a retracting cloth appearance, and you see in between them this is a fluid, so which is called as a serous fluid occupying in the cyst. The third stage is a debris formation in the hemorrhagic cyst. So you know about that that it is change in the clotting system. So the fluid is debrising level in the cyst. The debris is formed by the segmented form. Like the upper level is clean and lower level of the hemorrhagic cyst is little bit heavy. You feel like some cup with the solid marks and some cup with the liquid part. The rupture of the hemorrhagic cyst is unusual, but maybe the rupture of the hemorrhagic cyst is a result of the blood in the pelvic and echogenic fluid around the pelvic, the cyst and uterus. If the hemorrhage is severe, is called the hemoperitoneum, which is you always remember with the blood, and within the Morrison pause you can see that this hemoperitoneum, the blood collection, and this is also the sign of the ectopic pregnancy, which is mnemonic. So you see here, this is the free fluid in the lower pelvis pouch of Douglas. Stage 5th. So stage 5 is a hemorrhagic ovarian cyst is resembling a solid ovarian neoplasm. Another form of the hemorrhagic ovarian cyst shows echogenic material within the cyst, which usually happens during the subacute periods with the early stage clot formation in the cyst, and the ultrasound forming is mimic the solid neoplasm in the ovary. The follow of the ultrasound shows a dynamic changing within the hemorrhagic cyst, usually 4 to 6 weeks after. Beside the color Doppler flows imaging the lack of vessels, lack of vessels around the hemorrhagic cyst, but you see the hemorrhage like is going to the solid component, and this look like a mass. Differential diagnosis of the hemorrhagic cyst. So always remember, you can differential diagnosis. You cannot be excluded in the mind there is a neoplasm, there is some kind of appendix. Symptoms are similar: ectopic pregnancy, ovarian torsion, and adnexal mass. Always remember these things. Like a neoplasm in the ovaries, like papillary projections, you have to see, exclude the hemorrhagic cyst. Endometrioma have some vascularity with a low level of internal echoes. You can exclude by the MRI, and MRI can give us the answer. This is exclude the hemorrhagic cyst because the teratomas, the hemorrhage, the endometriomas have some solid mass, some solid components. Now we go to the treatment. Treatment of the hemorrhagic cyst is depend upon the stages, but we have to be follow up to leave the hemorrhage cyst and to just follow by ultrasound. The cyst is typical appearance in the hemorrhagic cyst. Follow up in ultrasound and MRI within the 12 weeks if the cyst is less than 5. If it's more than 5, you have to be go to the operate this cyst or drain this cyst. And we have to be exclude the postmenopausal patient, especially if the cyst is formed in the old age. So you have to drain and you have to follow the cyst, not going to be any new plastic changing or retained, and or size is going to be bigger. So this chart is very important, low risk and high risk. So less than 3, there is just follow by ultrasound. 3 to 5 is also by ultrasound. More than 5, you have to be drained, done MRI and ultrasound, and just follow up. But it's depend upon the symptoms. If the patient is silent, just you have to follow 6 to 12 weeks. But high risk, the early menopausal women who have the cyst less than 5 even, you have to done MRI to exclude the solid masses or the ovarian cancer cysts or the other problems related to the ovaries. MRI done is also for further for the early menopause is more than 5. Any cyst within the menopause, you can be done the surgery or the MRI, you have to do it. So this is a whole topic which I have tried to cover with the treatment, follow-up, and the related to ultrasound to the hemorrhagic ovarian cyst and its complication. Thank you so much.